All right. Good afternoon, National Mobilization for Reproductive Justice. As a Black woman working in behavioral public health, I was so excited to be tagged in to give this report on notable Black women in Black women's health, as stated right on the tail end of Black Maternal Health Week. Um, some things that I found out while, just kind of looking more into that is that Black women's maternal mortality rate in the United States is over 2.5 times the national average and 3.5 times the rate for white women, and is looking to worsen due to the current Trump administration's policies, which have removed maternal health data from government websites under the guise of dismantling DEI, put researchers on leave, and attacked the provision of culturally congruent care. And as we may have also heard, they've been trying to take history out of the books. And so this is another reason why I love that I get to give this report. And so I don't have the ability to share the link that Jordana had shared with me to to start this report. And if somebody can plonk it in there, that would be great. But we're going to get started. So, and I decided to go chronologically because it just feels right. So we're going to start off with Ada Bell Samuels Toms, who was born in 1870. And she was a devoted nurse who co-founded the National Association of Colored Graduate Nurses and fought for equal employment opportunities for African Americans in the American Red Cross and the U.S. Army Nurse Corps during World War I, and refused to accept rejection due to race. Her tenacity paid off when the Surgeon General agreed to a limited enrollment. So after the war, 18 Black nurses were appointed to the Army Nurse Corps in order to help combat the flu epidemic. So it's like, yeah, when you need us, yeah, then you'll bring us in. And she was also one of the first nurses to be inducted into the American Nurses Association Hall of Fame for her work with civil rights and Black feminist activism. Okay, Ionia Roland Whipper, born in 1872, was a physician and public health reformer. She was one of the few African American obstetricians in Washington, D.C. in the early 1900s. And after she discovered some of the shockingly unsanitary conditions in which young and impoverished mothers were forced to live, she traveled through the South during the First World War with the United States Children's Bureau to educate Black mothers and midwives about public health and hygiene. And she devoted most of her career to either teaching in or founding organizations to improve the lives of low-income Black women in Washington, including the Iona R. Whipper Home for Unwed Mothers, which served women regardless of race, and was Washington, D.C.'s only maternity home that admitted Black women. And it is still in operation today. May Edward Chin, who was born in 1896, was a renowned medical researcher for cancer detection. She developed a protocol for cancer probability predictions, looking into people's family medical history. She was one of the first Black women to graduate from Bellevue Hospital Medical College, as well as the first Black woman to intern at Harlem Hospital and be granted hospital privileges. And so, as I mentioned, she was an advocate for new methods of detecting cancer, but she was also an accomplished piano player who accompanied Paul Robeson for several years. Virginia Margaret Alexander, who was born in 1899, was a physician and public health researcher who used her desire to elevate the African American community through improved health conditions to found the Esperanto Health Home in 1931. And so this home provided socialized health services to low-income Black folks in Philadelphia, often free of cost. And so she was, very dedicated to improving medical care for Black women, children, and families, many of whom would otherwise been, neglected by the system. She was also someone who publicized the racial health disparities in health outcomes between Black and white patients at the time, such as Black babies dying at over twice the rate of white babies, and Black patients dying of tuberculosis at over 6 times the rate of white patients. And so her clinic not only served the underserved, but allowed young physicians to get the experience they needed in order to establish their own community-based practices. Faye Waddelston, born in 1943, was is an abortion rights activist with a background in nursing and midwifery. She became the youngest president of Planned Parenthood Federation of America in 1978. She was the first woman to hold the role since Margaret Sanger, and the first Black woman to hold the position. And she pushed them to increase their range of healthcare services and defended the agency as they received political opposition from the Reagan administration and the religious right. And she was also the co-founder of a quantum computer company and is president for the Center of the Advancement of Women. Nancy Boyd Franklin, born in 1950, is a renowned psychologist and writer. And so she specializes in issues that affect Black families and communities and has been instrumental in creating new therapeutic approaches that address the mental health of Black Americans in a way that also expands treatment options for this community. These approaches address the intersection of issues that Black families face, especially to support families living with HIV and AIDS and those living in inner cities. And she was somebody that spoke at the first White House conference on AIDS. Deborah Prothro Stith, born in 1954, was a physician and innovator who pioneered the idea that violence needs to be treated as a public health issue and a social disease rather than using a criminal justice approach, and as something that needs a preventative approach. She wrote a book called Deadly Consequences: How Violence is Destroying Our Teenage Population, and a plan to begin solving the problem, which inspired folks in television to begin to address the issue of violence in popular TV shows. And she is also the current dean at the Charles R. Drew University College of Medicine in Los Angeles, and was the first woman and youngest commissioner of public health in Massachusetts. And finally, Mae Jemison was born in 1956. She is an engineer, physician, and former NASA astronaut, as well as the first Black woman to travel in space. She is a trained physician who has contributed greatly to global health and development, and also appeared on Star Trek: The Next Generation. And so I believe that she is the first person to have been able to be an astronaut both actually in space and also on TV, which I love. And she conducted medical studies in Cuba and in a Cambodian refugee camp, as well as working for Flying Doctors in East Africa and working as a medical officer with the Peace Corps in Liberia and Sierra Leone, and has worked with the Centers for Disease Control to support vaccine research. Something that I really loved about preparing for this report was getting to learn about the scope of the lives that these women have. Because, so often we get pigeonholed into the one area that people want to talk about us working in. And, as you heard, these were multifaceted people who had impacts in both the cultures and in medicine and public health. So